Now, nearly 4 out of every 5 Kenyans have no access to medical insurance. Thus, a large part of the population is excluded from quality healthcare services. CNBC Africa's George Ndurango did get a chance to speak to Siddharth Chatterjee, UN Resident Coordinator and UNDP representative on the sidelines of the 47th World Economic Forum meetings recently concluded in Davos, Switzerland, and asked for his perspective on healthcare development in Kenya. Here's more.
I think we've come to a very exciting moment. Today, for example, the focus was at one of the meetings that we had on Kenya and the major strides that Kenya is making towards universal health coverage. I'm confident that if we get the partnership that we have in place right now of the public sector, of the private sector, and the kind of political leadership that the government of Kenya is providing, we are quite confident that in the next few years, Kenya will achieve universal health coverage and actually become a model for the rest of Africa. And let me put this further into context. You know, when you look at the Millennium Development Goals, MDG 5, Kenya completely missed it. And maternal mortality stayed as one of the biggest sword of the Damocles for Kenya. It has been tragic. But the government of Kenya seized upon this and saw this as something that they needed to address. So in the Sustainable Development Goals environment, which incidentally Kenya and Ireland actually were at the leadership of putting it all together, we are now focusing on universal health coverage, keeping the whole issue of reproductive, maternal, child health at the center of this. And the approach has been that we've gone together with the government, the United Nations system, have gone towards some of the remotest and hard to reach counties in order to address this. But what turned exciting was, in 2015, 6 private sector companies came together to join us in this initiative. And these counties are pretty dangerous and these counties are very, very fragile because of the insecurity there. And these companies are Philips, GlaxoSmithKline, Safaricom, Huawei, Kenya Healthcare Federation, and Merck. And outstanding work. What is happening over there is you're creating an entirely new ecosystem that has begun to work. And in the last 2 years, we've already seen a significant drop in maternal mortality, thanks to the leadership of the government. The meeting I'm just coming out from now is we are looking at setting up an SDG platform, which will bring together the World Bank, Philips, Unilever, the government of Netherlands, several other private sector partners, several other governments who will join this in order to kind of really look at how we can advance the Sustainable Development Goals agenda with one main aim in mind: how do we achieve universal health coverage?
Of course, one of the biggest issues when you talk about healthcare and most of this implementation, particularly from a government level, has been the time it takes to put everything from paper to actuality. Just give us a sense on how you've worked out conversation on time and how urgent it is to re-strategize everything.
Well, it is. That's why the government of Kenya is here. Right. And that is why they co-chaired this meeting with the United Nations and the private sector to look at what could be done with a sense of urgency. Right. What we are seeing is in the last 2 years, a significant drop, as I said, of maternal mortality in some of the hardest to reach counties. Now, this doesn't happen unless there are 3 Ps that come together. Right. The first P is the political will, which the government is demonstrating in abundance. The second is the right policies. The policies are there. How do we implement it, given that devolution has taken place and health is now a devolved function? So the governors have taken it very, very seriously. And the third is partnerships. Without the public-private sector really coming together, without looking at models of sustainability and a return on investment, we will not get there. I think Kenya can actually demonstrate to the rest of Africa how to get there.
All right, very profound. Let's move on to another issue, poverty alleviation, as we talk about some of the SDGs. Now, we saw some of the numbers being put about 24.6% Africa's population at risk of food insecurity. We argued that the Feed Africa campaign was falling short, more than 70%, depending on livelihoods for the agriculture, but falling short of those targets as well. What are we not addressing as priority within this conversation?
Africa as a continent, and Kenya in particular, is at a very exciting moment of demographic future and demographic history. We are at the cusp of what would be termed as a demographic dividend. Take, for example, Kenya's population in 1956 was the same as Sweden, 7 million. Today, Kenya is 45 million and Sweden is 9.8 million. By 2030, Kenya will be 65 million, and by 2050, Kenya will be 85 million. The population of Africa will be 2.1 billion. I see this as an incredible opportunity. If we want to address issues of poverty, if we want to address issues of instability, if we want to address issues of economic growth, we have to address issues of youth and women. And what does that mean? We need to invest in what I would term as the 4 E's. Education and the right skills for emerging economies, and rapidly. Secondly is empowerment. If we don't free up women from the household into the marketplace, and women are not, and girls are not allowed to reach their full human potential, we will not be able to achieve that demographic dividend. Take, for example, a recent report which was launched by called the Africa Human Development Report by Helen Clark, the UNDP administrator, and President Uhuru Kenyatta, the president of Kenya. We have seen that in sub-Saharan Africa, $95 billion is lost every year because of gender inequality. Right. The third is employment. We have to really look at a Marshall Plan of mass-scale employment generation, agriculture, infrastructure, small and medium-sized enterprises, the whole range of it. Right. And finally, the most important part is equity. So places that have been traditionally marginalized and all that need to be brought into the economic mainstream. If we get these 4 E's right and we make the right investments over the next 5 to 6 years, by 2030 to 2050, we will achieve not just a demographic dividend, but put all of Africa and certainly Kenya as a first world country.
Absolutely perfect. Now, we're done with that conversation, but there's one more piece we were set to do. It's about you and your role within the UN and how you got there, UNDP. It's for Forbes Women. So I would need you to tell me a bit about how you got in and how the journey has been, maybe in about 2 minutes. And then tell us more profoundly about how women fit into the whole equation.
Look, I have declared myself a feminist. I really believe in the equality of genders. I really believe that somehow as men we need to take responsibility of espousing the affirmative action that needs to follow in terms of gender equality and the empowerment of women. So in my case, I started my journey actually as an officer in the Indian Army Special Forces, and I served over there, and and I then took a break from that career and joined the United Nations. The United Nations has been a fascinating journey. If the world really wants to see global development, if it wants to see poverty alleviation, it wants to see, the end of conflicts, it is the United Nations that can serve that well. And that's precisely why I joined this organization back in 1997. And I've served in countries like Bosnia, Iraq, South Sudan, Somalia, Darfur, and these are the kind of environments that I've been serving in. But it's been fascinating because, when you can see children being immunized, survive malnourishment, a woman, being able to deliver a child safely without the worry of dying from a pregnancy-related complication, it is perhaps the most gratifying. I came into this role in August of 2016. I'm honored that, Helen Clark, the UNDP administrator, recognized that I could actually lead the UN country team in Kenya, coordinate it, and help achieve it. And I think that we have a fabulous partnership between the United Nations development community in Kenya, together with the government of Kenya, and most importantly, the development partners, countries such as the United States, Canada, Norway, Denmark, Sweden, Finland, have just been, Japan, Germany, have been great partners of ours in advancing, for example, the health agenda in Kenya. So, the European Union is currently working with us in a cross-border initiative, between Kenya and Ethiopia, which was signed by the heads of state of Kenya and Ethiopia in order to advance peace and security, to advance human development, to alleviate poverty. I think the moment is here. Kenya is actually showing a beacon of hope, which could potentially be emulated by all the regions, all the other countries in the region, because we need a strong Kenya. We need a stable Kenya, which becomes a beacon of hope for the rest of the fragility that is around us.